Okay, so abdominoplasty surgery is often trivialised a little bit as something called a tummy tuck. And in my practice, patients come in various different shapes and sizes. I can get the slim ladies who've had children and who've got an excess of skin, particularly in the lower part of the tummy, which they feels they don't know quite whether to tuck it underneath their belt or over the top of the belt, and it feels in the way. And also, as a result of childbirth or weight loss, often ladies have a degree of abdominal wall weakness, so as when they stand up, they get a bulge forwards. And so that's one group of patients, and the other group of patients are the patients who are somewhat larger to start off with and are looking to have an operation to change their body shape, and particularly their trunk shape. And there are different approaches to the patients. I think in all circumstances it's not an alternative for weight loss, and that's sometimes a difficult conversation to have with someone, to say, well, look, what have you changed about your life? What's your weight doing now? How tall are you? What's your body mass index? Is your weight stable? Can you actually manage to decrease it? And maybe having a tummy tuck or abdominoplasty is the goal at the end of things when you have lost your surgery or have lost your weight. And the abdominoplasty itself is a big operation. It involves having a scar from hip to hip, and usually around the umbilicus, the tummy button, and we lift all of the skin and the fat off of the tummy wall, and then bring it down, take off the excess, and remodel things. So that's the skin and the fat excess, and then the second part of it is to tighten up the abdominal wall fascia, which is the, if you like, the plastic bag lining joining the muscles together, and that's the bit that's been stretched during childbirth. And if that's tightened, then when the patient stands up, they can have a much flatter profile of their tummy. And then, depending on the patient's shape, then the surgery can be combined with liposuction, just to smooth off edges or to take off some of the excess. So there's lots of different combinations. And in the smallest operation from an abdominoplasty point of view is actually to do a mini abdominoplasty, where the scar still is from hip to hip, or a slightly shorter scar, but with no surgery around the umbilicus. So, and that takes off the little bit of poochy excess abdominal skin that people like or don't like. And again, the smaller operations like that, potentially they can be done under local anaesthetic, but where an abdominal wall tightening procedure or a full abdominoplasty is going to be taking place, that's 2 hours or more of surgery. The patient's going to be asleep under general anaesthetic, and they're going to be in hospital in my care between 2 and 3 nights.